Good afternoon, everyone. Welcome to our webinar this afternoon on CoreQ and AHRQ stuff. We will be starting the webinar in a minute or two. Just give folks an opportunity to join. But thanks so much for joining us this afternoon. Good afternoon, everyone. Once again, we'll just give it another minute or two, and then we'll start the webinar. Okay, well, the hour of noon or 1 o'clock has arrived, I should say. Good afternoon, Florida long-term care friends. On behalf of CareFeed, I'm pleased to welcome you to our today's webinar using AHRQ and CoreQ surveys to advance compliance and quality. My name is John Vandermeer. I'm Director of Regulatory Affairs at CareFeed. Thank you so much for joining us for today's session. As many of you know, beginning in 2026, Florida nursing homes will be required to conduct patient safety as well as resident and family satisfaction surveys in their facilities. These requirements, enacted through provisions in the Florida state budget passed this summer, mandates the use of CoreQ surveys, a survey system developed in partnership with the American Healthcare Association and the anonymous employee-based patient safety surveys developed by the Agency for Healthcare Research and Quality, or AHRQ. While the rulemaking process is still underway and final rules have not yet been issued, our goal for this webinar is to provide practical updates on the regulatory process and other useful perspective on potential implications for provider compliance, reputation, and reimbursement. We also hope you can gain practical insights on steps you can take now to prepare your communities for the successful implementation of these requirements. Before introducing our stellar panel, let's start with a few housekeeping items. First of all, please note that this webinar is audio only for attendees, but the panelist video will be visible. We have a detailed PowerPoint and a copy of the slide deck will be sent out to all attendees following the webinar, so keep that in mind. A recording of the webinar will also be made available to all attendees. And very important, we want to make this a collaborative learning experience. Please submit your questions throughout the presentation using the Q&A button at the bottom of your screen. It's important to note in these sessions that if you have a question, chances are other folks have a question too, so use it as a learning opportunity for everybody. And then finally, in terms of the housekeeping items, the webinar will last approximately 40 or 45 minutes, including time for a Q&A session at the end of the presentation. I'm thrilled to be joined by two outstanding experts who bring both policy insight and practical experience to this discussion. First, we have Tom Parker, Senior Director of Policy and Reimbursement at the Florida Healthcare Association. Tom has been at the forefront of Florida's long-term care policy discussions and brings invaluable perspective on the legislative and regulatory developments shaping provider requirements and reimbursement strategies. Next, I'm pleased to introduce Robin Safford, CareFeed's CoreQ coordinator. Robin works closely with providers nationwide to help them implement CoreQ surveys and meet compliance expectations with the survey administration process. Together, we'll explore how providers can prepare for 2026, integrate CoreQ into their daily operations, and leverage survey insights to advance both compliance and quality performance. Tom and Robin, thanks so much for being here today. Let's take a quick look at our agenda for today's session. We'll begin with an overview from Tom on the policy and regulatory context surrounding Florida's 2026 survey requirements. Tom will explain how these mandates came about, where things stand in the rulemaking process, and what providers can expect moving forward. Next, Robin will discuss the CoreQ and AHRQ patient safety surveys, focusing on what these tools are, how they can be administered, and some of the background on the valuable information that they provide. From there, I'll share some thoughts about a few operational and strategic opportunities that can be realized by using CoreQ and AHRQ survey on patient safety. We'll talk about how providers can use data from these surveys to guide action planning, enhance resident satisfaction, and support both quality outcomes and financial performance. Then we'll bring it all together on the final topic of preparing for 2026. Practical steps providers can take right now to ensure readiness, even as final rules are still being developed. Finally, we'll wrap up with a Q&A session where we'll answer all your questions and address key concerns about implementation and best practices. So, Tom, could you start us off with a quick overview of what's driving these new survey requirements, how they fit into Florida's broader quality and reimbursement framework, and how we look ahead to 2026, what providers should be watching most closely?
Yeah, thanks, John, and thanks for having me, and good afternoon, everyone. The Florida Senate specifically, and the legislature as a whole, has been really focused on creating what they've called the gold standard for long-term care in the country. Florida likes to tout itself as the most veterans-friendly state in the country. They like to tout that they're the best value in public education. And so one of the things under the leadership of Senate President Ben Albritton has really been, when he leaves as Senate President after the next session, he wants to be able to point to long-term care in Florida and say, we have the best long-term care in the country. And so, he really tasked the association and provider representatives with, how do we get there? What's the pathway to achieving that gold standard? And so the association held just a multitude of meetings with all different stakeholders to really kind of say, what are the best practices out there in long-term care, the facilities that are really doing it right. What is it that they do that may be different than others? So we collected a series of recommendations, vetted those through all of our channels here at the association, whether it be our legislative committee or our board or different committees there, and brought together a series of recommendations, and then other people did as well. And that's what ultimately ended up in Senate Bill 170, which was the nursing home kind of gold standard bill, and then ultimately got rolled into Senate Bill 2514, the budget bill, where it was passed. So there are several provisions in there, and I'll just kind of briefly touch on the non-survey related ones that we're going to focus on today. But the state is working with a contractor currently, Guidehouse. Those of you who have been around for a while may remember the name Navigant, who helped the state develop the prospective payment plan back in 2017. They now operate as Guidehouse. So Guidehouse has been brought in to do a study of Florida's current quality model, what's working, what's not, what makes sense to continue, what are some things that other states may be doing in the quality incentive reimbursement system that are helping drive quality, and to make those recommendations to the legislature. Additionally, that report is going to look at how long-term care facilities can better leverage technology to drive down cost and continue to improve quality. And then looking at three different populations specifically about developing or changing some population-based add-ons. And those are making adjustments to the current ventilator Medicaid add-on, creating a bariatric Medicaid add-on, and then lastly, creating a behavioral health population-based add-on. So Guidehouse is currently studying all of those. They've had some meetings with the association. I think we'll have a chance to talk with them again about some of those recommendations before that final report, which is due in early January to the Speaker of the House, the President of the Senate, and the Governor's office. So they have all of that ready to go for legislative session this year. The other report that was in that was a quality measures report, an annual report done by the Agency for Healthcare Administration, where they're going to report on every provider in the state's quality points in the Medicaid system. So they'll have the legislature will have kind of a one place to look in a easy to view place to see who's getting a quality add-on, looking at points awarded across all of the different measures included in that Medicaid add-on. Similar to some other reports they do, like for instance, the agency's been doing a direct care staffing report for probably 17, 18 years now. So this will just be another report. So, be something the legislature will have handy, easy to look at, and be able to just at a glance kind of see what's working and what's not with the Medicaid quality. Better leveraging the state's electronic medical or health information exchange. So providers will have to use, with their EHRs, will link up with the state's health information exchange to transmit admission, discharge, and transfer data. So that will just help payers and the state as a whole kind of have a better understanding of where people are at in the healthcare continuum. Providers can opt in to receive that data as well. There is a cost associated with receiving that data, but that is something that providers could opt into. But the requirement is just to transmit the data. Uh, Providers have to have a certified medical director, and that's a PULP Med certification, which some of you may know as AMDA. They've changed their name recently. It's the American Medical Director Association. So the agency will be collecting data on every facility's medical director, and they need that by January 1, just through the licensure portal database. You can go in and report who your medical director is. And then we do anticipate seeing a rule coming out on that very shortly, that kind of speaks to the timeline around getting that certification. So that piece is still coming. Do think we're going to see a multi-year phase in of that certification requirement. So something providers should be thinking about, but not necessarily anything you got to act on now. But they do want that reporting of your medical director in through the licensure portal. And then kind of the last non-survey piece of that was there was some enhanced fine language around the Florida Nursing Home Uniform Financial Reporting, the FNURS reports. Providers can be fined up to $10,000 for each 10-day violation for not submitting your audited financials timely. The legislature also, as part of that fine language, did give AHCA a little more broad authority on not fining providers for reasonable justifications for not submitting. And they have had the draft rule hearing on enhancing that fine language. FHCA participated in that and provided some good comments. So I do think we're going to see that rule, the proposed rule version of that very soon, which will actually start to work towards implementing that. I do think that most providers are complying. I've received a list from AHCA for 2024 reports. There was about 70 providers on it, so about 10%, and a couple of those were ones that shouldn't have been on it. We worked through, so it does look like almost everyone is submitting their reports. So hopefully that's not a big issue. So as we kind of look at the two survey requirements that come out of this that John touched on in his opening and are really the focus today. So what I will say with both of these is AHCA has to conduct rulemaking. They have to adopt questions. They have to develop protocols around survey size and submission requirements and all of that stuff. So none of these are effective today from a requirement standpoint. The agency has released in their state regulatory plan. Each state agency submits a list to the legislature of kind of what their timeline is for rulemaking over the next year, where they're kind of looking at all of their rule issues. They did share on that they're hoping to have both of these rules done by the end of January. So just kind of in the back of your mind, be thinking towards that as a timeline. We'll see if they actually hit that or not, but that's what they've shared as their goal. So really, what are we talking about here with these two surveys? The first is a resident, both your short stay and your long stay residents. and then the family satisfaction survey using those CoreQ questions that Robin's going to spend some time on next. But really to create a standardized resident and family satisfaction tool. We all know there's, you've got Google reviews and a place for mom and Facebook and all of these different sites out there that have ratings about the care you all are providing. And there's really no consistency across those. So the idea here is let's create a single consistent survey tool that every provider in the state will be administering. We can capture that data, we can measure providers against each other, and then ultimately that data will be reported on a state agency website. I'm kind of we'll see what they put in the rule, but in my mind, I'm envisioning kind of on Florida Health Finder. If any of you have been on that, that site, within each facility, there's a list of who the administrator is and the chief financial officer, soon to reflect the medical director. There's survey history on there. There's various services that facility may offer, payers that they take, etc. All of your emergency power plan information is there. So I'm envisioning just kind of another entry on that page of how you did on your CoreQ surveys. And Robin will tell you kind of how they measure that and what that looks like momentarily. So it's a sample of your residents, and it's got to be statistically significant before they start publishing anything. And then ultimately that resident and family satisfaction survey score, once it's been in existence long enough that we have some good data, and the state's able to use it, the legislation does require AHRQ to incorporate that as a Medicaid quality measure going forward. I would imagine that's a October of 2027 rate setting at the earliest time frame, and maybe even the year after that, just depending on how long it kind of takes to get the rulemaking done and start collecting this data. But know that at some point, it's also going to roll in as one of the Medicaid quality measures. The other survey that's come out of this is the AHRQ, what they call the Patient Safety Culture Survey. And this is something that the state was adopted by the legislature, passed a few years ago, and the state was implementing for hospitals and for ambulatory surgical centers. It's taken the state a few years to get that implemented, but they did just collect the first round of data this summer between June and August for all of the hospitals and AMSurg centers in the state. And really, it's an employee measure of the care being provided in the facility. And again, I think Robin's going to kind of go into some of those questions, but the idea is to have an anonymous data source where your staff can truly share where they feel what's working and what's not. So you as facility leadership, as corporate leadership, can really evaluate and understand where you may have things that you can improve. Ideally, you take that data and use it to make things better in the facility. And then there'll be some state level benchmarking and things like that. So that's a suggestion that came from the Agency for Healthcare Administration. I think they were believers in it after some of the stuff they're seeing on the hospital side. So they felt like it was an important tool to be used on the long-term care side as well here. So again, AHRQ is going to be working through rulemaking on this. Lots more information to come. But we have a pretty good idea of where they're going. So now they've kind of have laid out the regulatory context and the why behind this. I'm going to turn it over to Robin from CareFeed to kind of walk us through the details of what's in those CoreQ and AHRQ surveys.
Thank you, Tom. So I'm Robin. I'm the CoreQ coordinator at CareFeed. So I'm responsible for administering CoreQ surveys on our clients' behalf. Hopefully there are some of you that I've met on this call. So today I'm going to talk about the CoreQ surveys and the patient safety culture surveys, a little bit of background on those surveys, why they're being used, how they are used. So first I'm going to go into the CoreQ survey. So CoreQ is a short, validated, and standardized questionnaire. It's designed to calculate quality measures for skilled nursing facilities and assisted living facilities across the country. It's a very simple survey. It is 3 to 4 questions depending on the audience of the survey, but it is a powerful tool that helps to gauge the experience of our most important clientele, our residents and our families. So CoreQ surveys are available for short stay discharge, skilled nursing facility, long stay resident and family, and then assisted living resident and family. We had Dr. Nick Castle, the developer of the CoreQ survey, on a webinar earlier this year, and he said that AHRQ is also in the process of developing and testing CoreQ surveys for hospice, personal care, and employees, which is very exciting. CoreQ is used as a benchmarking tool. The CoreQ survey results can be reported to long-term care trend tracker, AHRQ's long-term care trend tracker. Those results you can use to benchmark against your facility over time or facilities across the country. So again, great benchmarking tool, provides you with a lot of comparative data. CoreQ is also increasingly being utilized by state Medicaid and service survey agencies as a factor in quality reporting and pay-for-performance programming, making it an important measure for providers who want to increase reimbursement and maintain compliance. CoreQ also fills a gap that other tools like CHAPS maybe are missing. The CHAPS survey is longer and lacks a summary, whereas CoreQ, like I mentioned, is very short. So response rates tend to be higher, usually an average around 65%. And also the results strongly correlate with other quality indicators like turnover and closures. Ultimately, why we like CoreQ so much is it gives a well-rounded view of satisfaction across the care continuum. It's designed to be quick and efficient, meaning it won't overwhelm respondents, but still delivers some big and meaningful insights. So bottom line for CoreQ for providers, it's an essential tool for understanding and improving the resident experience. So it's like I said, very simple, very easy, very user-friendly, and it does provide a lot of data to individuals that utilize it. Let's dive deeper into CoreQ and why it's become a quality tool. So next slide, you can see the CoreQ questions for our long stay resident and family. So you can see it really is just 3 simple questions. It's designed to be simple and direct and focus on the resident and family experience. They answer their 3 key questions, and they're all very similar, but capture the experience of the individual. So the questions are, in recommending this facility to your friends and family, how would you rate it overall? Overall, how would you rate the staff? And then the third question varies depending on the audience, but how would you rate the care you receive, or how would you rate the care your loved one receives? So those questions are answered on a 5-point Likert scale, 1 being poor, 5 being excellent. And then you can get your satisfaction score and you can get your overall CoreQ score. So 2 big scores to look at. This rating system allows providers to track performance, identify areas for improvement, ensure that they are striving to enhance the resident and family experience. So very easy to see where you're following on that Likert scale and know where you need to make improvements or know where you're doing well and to keep up the good efforts. It's very understandable to be concerned about how the survey results might be interpreted, especially when many factors affecting satisfaction or safety are not entirely within a provider's control. But we have seen that the CoreQ survey does tend to range upward in the satisfaction area. So because the survey is standardized and benchmarked, it tends to compress the scores upward. So many respondents cluster in the good to very good, excellent range rather than the lower scale. And this year, the satisfaction scores that we've seen across facilities we've administered CoreQ surveys for to be 90%. So a nice high satisfaction score for those individuals. It also provides an opportunity for advancing operations and excellence, which Don will talk about in a minute. Before he does, I'm going to go into the AHRQ. So next we are going to cover the AHRQ Nursing Home Survey on Resident Safety, the Patient Safety Culture Survey. So this survey is going to be administered to staff. Its purpose is to measure staff perceptions on how their facility reports safe, resident-centered care, focusing on culture, communication, and teamwork rather than outcomes. This survey was developed by AHRQ, which is the Agency for Healthcare Research and Quality for Long-Term Care. They released an updated version of this survey this year, which was a nice little update. It reduced the number of questions to about 25 items over 8 domains, which include handoffs, communication, training, feedback, staffing, and overall safety ratings. So this survey is great for identifying strengths and gaps in safety cultures. It tracks changes over time. And then, as Tom mentioned, results will be reported to the state agency so that benchmarking data can be provided to communities. The challenge with this survey is that it does require adequate staff participation. It is a longer survey, so you will need your staff to be willing to complete the survey. And then it will also require a commitment on the community's end to act on results and take those results into account. Its effectiveness really depends on the leadership, the follow through, and the capacity. We always suggest ways on improving response rates for these types of surveys. We know employee surveys can be challenging at times. So for this one, incentivizing them to complete the survey, maybe with like a pizza party or a raffle at the end. And then also acknowledging that this is a work task, so they need to be able to complete this survey during their work hours. So maybe allotting them specific time during the day to complete that survey, not within their break or their lunch, but at their own individual time to spend 20 minutes on this survey, or whatever amount of time you feel like is fair for them to provide insightful answers to the questions. So bottom line on this survey, it helps facilities to move beyond compliance to build strong learning-oriented safety culture that supports continuous improvement and resident well-being. So I'm going to hand it back over to John. Now that we've covered the details of the surveys themselves, he's going to talk through how facilities can use this data strategically and not just meet compliance, but advance their quality and operational goals.
Great, thanks, Robin, and thanks, Tom. Really good presentation so far. I'm to take us in a little bit of a different direction here. So we talked about the requirements and the fact that these surveys are going to be required to be implemented at the facility level in Florida. I think what I'm going to focus a little bit more on is the way that we can use these surveys, the providers can use these surveys in a strategic way to advance quality and advance operations within their facilities. Excuse me. This summer, along with my friend Karen McDonald, the Chief Clinical Officer for Mission Health, Tom and I had the opportunity to give a version of this presentation at the FHCA conference. And during that session, there was very lively and I think really interesting conversation and concern that providers had relative to the implementation of these surveys, particularly as they're a measurement and a mechanism for compliance and reimbursement policy. And Robin alluded to this a little bit at the outset. I think that there are a couple of points to emphasize about this. As you all know, sort of over the last 20 years, fee for service has increasingly given way to pay for performance models in the reimbursement world on all levels of healthcare. And given the significant pressures that will be placed on the Medicaid program resulting from action at the federal level earlier this year, I think that this really puts providers, the fact that these policy mechanisms were implemented on the front end, I think will give providers significant value, on the front end for Florida in the long run. Ultimately, sort of being proactive in the policy development process places providers of being in the position of shaping the way policy mechanisms are implemented before they're actually, kind of inflicted on the provider community. Sort of to put it another way, it's better to be at the table than on the menu. But sort of beyond that, by leaning into the use of these surveys in a multifaceted way, providers can really transform a compliance mandate into a strategic advantage, and improving and using it as a tool for improving care quality, staff engagement, and community trust, sort of all at the same time. I think that in my observations of long-term care and long-term care operations, I think that the most effective operators in the long-term care world are those who can not only meet compliance expectations, but strategically integrate those compliance expectations, um, in and sort of facilitate a net result that advances key indicators within their facilities. Um, as Benjamin Franklin said, critics are our friends. They show us our faults. I know some people might say that critics are very friendly, or surveyors can be very friendly during the survey process, in that respect. But I think that with the CoreQ and AHRQ feedback, it really provides more than just a satisfaction survey. It's a powerful tool for organizational management and continuous improvement. And one of the ways that you can maximize the value of CoreQ is by using it as an organizational management tool. And let's get into some of those components here. First, CoreQ allows us to identify strengths and weaknesses within our organizations. By analyzing the survey results, we can pinpoint areas where residents and families are highly satisfied and leverage those strengths for marketing, reputation building, and staff recognition. It also helps us target low scoring areas for focused improvement initiatives. Um, as always, to understand the why of satisfaction being low, root cause analysis becomes an essential tool to uncover some of the deeper issues behind that feedback. So integrating that into your QAPI committees and so forth can be very valuable in that respect. Secondly, CoreQ feedback should directly influence our daily operations. We can use these insights to align care delivery and communication with what residents truly expect and ensure that meeting CoreQ benchmarks and AHRQ benchmarks becomes a part of our ongoing quality standards. Third, CoreQ data plays a critical role in strategic planning. By analyzing strategic satisfaction trends over time, we can develop long-term quality improvement strategies and improve resources and prioritize resources for areas that matter most, like improving dining or staff satisfaction as a couple of examples. It also lets us set clear, measurable goals, for example, by increasing dining satisfaction by 10% over the next year. So we know what we're working toward and how to measure success. Fourth, CoreQ enables us to monitor trends and benchmark performance. By comparing our scores to state and national averages, we gain perspective on how we're performing in the broader landscape and can identify best practices for high-performing areas. As a part of this process, we should also be sure to use SMART goals, which is to say specific, measurable, achievable, relevant, and time-bound to guide our improvement efforts in a focused and actionable way. Fifth, CoreQ helps us build accountability at every level of the organization. So we can tie department and team incentives to improvements in CoreQ measures or AHRQ measures that ensure leadership is actively involved in monitoring and achieving satisfaction goals. Reviewing key operational metrics like staff response times and turnover rates helps us connect survey feedback to real operational performance. Finally, CoreQ and AHRQ information can guide us how we allocate resources. By focusing on high impact areas like staffing levels or facility improvements, we can use these as efficiency metrics to track performance and ensure that the resources are invested in the areas that they're most likely to make a difference. So from organizational management tools to quality advancement tools, let's talk let's dig a little deeper into some of those areas. So while upcoming satisfaction survey requirements, again, may seem like just another compliance task, they also present an opportunity, a powerful opportunity to use these systems as opportunities for learning, engagement, and sustained excellence improvement for your organization. So exploring how to use CoreQ and AHRQ to advance quality, build trust, and set apart providers from the marketplace. First, CoreQ can strengthen our partnerships with AHCA. That's the American Healthcare Association, not the Agency for Healthcare Quality. They can help us advance our relationships with AHCA and NCAL by engaging in AHCA NCAL training programs, webinars, and improvement resources. We can stay aligned with CoreQ benchmarks and provider community best practices. Additionally, participating in the AHCA NCAL Quality Awards allows us to align our quality efforts with national standards while also building public trust and recognition for the care that we provide. And second, CoreQ enables us to leverage positive feedback in meaningful ways. So when CoreQ results show areas of high satisfaction, we can celebrate those successes both internally and externally to build trust with families and boost staff morale. Recognizing staff for their role in achieving high satisfaction scores reinforces positive behaviors and can help sustain a culture of excellence within the facility. Third, CoreQ gives us ability to learn from peer benchmarks. By comparing our scores to state and national averages, we can assess where we stand and identify areas for growth. Fourth, effective follow-up and use of CoreQ data are really critical. We need formal processes to review and act on CoreQ feedback, including focus groups and deeper analysis of issues that emerge. So staff can be trained to interpret and respond to satisfaction data at the frontline level, ensuring that feedback translates into real improvements. Including CoreQ data and AHRQ data in the admissions packet is also a powerful way to demonstrate transparency and commitment to perspective for residents and families. Finally, there are a few key best practices to keep in mind while leveraging CoreQ and AHRQ for advancing excellence. I think, as you talk to effective operators around the country, maintaining a continuous quality improvement mindset, even when scores are high, is a critical sort of benchmark for success or strategy for success. There are always opportunities to kind of do things better. Small adjustments like improving response times or adding more menu choices can make significant differences in the resident and family experience. Secondly, by using technology and automation to make the process more efficient, which Robin can talk about in a second here, gives providers a real opportunity to gather feedback in real time, and technology can reduce the administrative burden for providers while providing actionable insights for timely improvements. So in summary, by using CoreQ and AHRQ survey data strategically, we can create a continuous culture of excellence, improve care delivery by fostering trust and building stronger reputations that attract both residents and staff to your facilities, all while staying aligned with compliance expectations and reimbursement expectations. The one thing that I just wanted to include as an important call out here, CoreQ CoreQ really dovetails very effectively with the quality advancement process through the National Quality Awards through AHCA NCAL. As you all know, AHCA NCAL National Quality Awards offer providers an effective tool for advancing quality within your facilities. But I don't know, maybe some of you may not know, that CoreQ data also provides an effective method of satisfying an important section of the facility's application. A facility applying for the bronze, silver, or gold national quality awards must provide quantifiable information on satisfaction for that section of the application. So making sure that there's quantifiable evidence of consumer satisfaction and engagement allows providers to use CoreQ data to complete this, the consumer results portion of this application. In addition, the consumer results section of the quality award also requires evidence of resident satisfaction trends and outcomes. And CoreQ data can be used to fill these criteria. Number one, by demonstrating improvements and efforts through year-over-year score comparisons. And two, by aligning key business results such as increased referrals and occupancy rates due to high satisfaction levels. And finally, all of these scores can be integrated into a results-driven action plan. Based on CoreQ results, the facility can develop a quality improvement plan to address areas needing enhancements such as resident engagement, programs for social and recreational activities, or improving staff recognition on person-centered care feedback trends. So those are just some of the areas in which you can use not only CoreQ, but potentially AHRQ data, not only to advance excellence within your facilities, but also to enhance the reputation of your facility through participation in the National Quality Awards process. So that is my section of the presentation, and I am going to take it over, broaden the conversation a little bit to preparing for 2026. As we first to you, Tom, I mean, as we consider, some of the ways in which providers can approach 2026 relative to AHRQ and CoreQ survey requirements that were enacted as a result of the state budget this summer. Any final thoughts that you have about things that you would advise your members to consider as we approach 2026 for providers?
Yeah, I mean, I think in both cases, right, with both surveys, it's probably a good idea to, at the very least, be thinking about administering these things. But it may make sense to start, and maybe you do a sample on the AHRQ, on the patient safety culture survey, right? You sample 10% of your employees, just so you can kind of get comfortable with the process. You kind of understand what the results look like. You understand how to get results, right? I think that was an important point you made, John. Obviously, you gotta get people to do these surveys. So, maybe it makes sense to start on this a little earlier than the rule requirement, because, once that all gets implemented, then at that point, that data is now live and real, right? You're gonna have to share that with the state. They're gonna have it. They're gonna post it publicly. In the case of the CoreQ questions, it's going to become part of your Medicaid rate in the future. So it may make sense to start working through some of this a little early, just so you can kind of get comfortable with it and have a handle on it. Yeah, I mean, that's the big one, right? Let's not necessarily let's wait on this stuff. I do think sometimes with agency rulemaking, you worry about kind of getting out ahead of things. Even like I mentioned on the medical director piece, the certification, there's going to be some time associated with that. In this case, the statutory language was very explicit on which questions are going to be included. It didn't just tell AHCA to develop a patient safety culture survey. It specifically spoke to the AHRQ questions. In the satisfaction section, it specifically spoke to questions that had a national quality forum endorsement, which is the CoreQ questions. So, I mean, I think we know what those questions are going to be. Some of the timelines and the percentages to meet the requirements will still be worked out, but we've got a pretty good idea of what the questions are going to be. So, something we should all be thinking about right now.
Great. Thanks, Tom. And I think it's worth having Robin go through some of the things that providers need to know about that process that Tom was talking about relative to conducting CoreQ and AHRQ patient safety surveys. But quickly before I do, as Robin offers these final thoughts, please use the Q&A button to type any questions you may have so that we can answer those in the Q&A session at the end. But before we close, I'll turn it back to Robin to share how CareFeed supports providers in implementing these surveys and turning results into meaningful improvement.
Thank you, John. So for the CoreQ distribution service, I will work directly with you and your communities to develop a survey distribution plan and a go live plan. So we start by collecting a list of who should receive the surveys. Surveys should be distributed to a certain residents, certain family members. There are some exclusions with the CoreQ survey, and I guess ahead of that, the CoreQ survey does have to be administered by a third-party vendor, an AHRQ-approved third-party vendor, which CareFeed is. And this just ensures that all the data is valid. No one's cooking the books, so to say. So we would get involved. You would provide us with a list of residents and family members that are eligible to receive the CoreQ survey. Your staff will ensure that all their contact information is up to date, either in CareFeed or in your EHR. If we don't have good, valid contact information, we have no way of getting them the survey, which is going to lower our response rates and make getting that feedback a little bit trickier. So once we have the resident list and the family member list, updated contact information, then we talk about sending out those surveys. We pick a go live date and we go. Surveys are going to be distributed via text and email, and then residents at the community will have an option to do an in-person survey with a staff member at the community. This will honor all CoreQ rules and regulations. So CareFeed is set up to make sure that the survey does remain anonymous. And then I will make sure that your staff is properly trained on administering these surveys so that they can administer them and honor those CoreQ rules and regulations. Once we end our survey collection period, I will collect all those responses, get your data analyzed, and provide you with a report on your CoreQ findings. I will also submit any reporting to required state agencies or AHRQ, NCAL long-term care trend tracker, depending on what the final ruling requires and what the facility wants me to do. But that is the very abbreviated version of how the CoreQ survey distribution process goes. So if you guys have any questions specifically about CoreQ surveys, getting them going, how the process works, more details, please feel free to reach out to me. I'm here to help. I'm here to answer any questions that you guys have. Thanks.
Great. So we're at the intersection of question and answers. I know we have at least one question in the Q&A section, and I'll get to that in a second. But if anybody has any other questions, please put some of those in the Q&A button at the bottom. Chances are, if you have a question, other folks will have a question too. So the first question we have is, we are currently running the employee experience surveys with another survey company. Would we be able to use the data towards our employee part? Tom, I think that
Yeah,
I don't know if
yeah.
you.
I'm not familiar specifically with what questions that group uses, but the legislation is very specific that it has to be the AHRQ questions. So I think you're going to have to use those questions. They want every provider in the state to be using the exact same questions, the exact same survey tool, so that they can do that kind of that state benchmarking from provider to provider. So yeah, I don't think you're going to be able to use that current survey tool that you're using.
Got it. And then the next question is, do both survey types require a third-party vendor to administer? So as Robin mentioned, the CoreQ survey is required to be administered by a third-party vendor. Does the same requirement exist for AHRQ surveys? And Robin, my sense is no on that,
Yes,
facilities are able to administer that. Is that correct?
yes, I think it's suggested that a third-party vendor administer those surveys, but it is not required like CoreQ.
Great, thanks.
Yeah, the legislation specifically speaks to a facility may contract with a third party vendor to administer on the AHRQ questions. But there's a lot of paperwork behind, collecting those, compiling the data, submitting the data. So, do with that what you will.
Yeah. And the other component, I mean, just the one of the key components of the requirement of the AHRQ surveys is that they be anonymous. So even if you're conducting this at the facility level or at the corporate level, you want to make sure that those surveys are able to be conducted in an anonymous fashion. Great. So more questions coming in. That's great. Yes, we will send out a copy of the slide deck and a copy of a link to a recorded version of the presentation will be made available to attendees or anybody who requests that information upon request. So that's that question. And then how will the AHRQ surveys be required to be submitted? So,
John,
yeah,
I can
please,
probably
Tom,
speak
go
to
ahead.
that one a little bit if you would like. So, the first thing I will say there is something that I'm not sure we touched on is those AHRQ, the patient safety culture surveys, are required to be administered every 2 years. So just kind of from a timeline standpoint, that's the timeline on the AHRQ surveys every other year. So AHCA will develop a web-based portal similar to a host of other ones they have. But essentially, either you, the facility, someone in your corporate office, a business partner that you have a relationship with, like CareFeed, could submit them for you. But you will log in, select your facility, select your reporting year, identify who it is submitting the data. And then again, and this is based on how hospitals are required to submit them now. So we're envisioning the same thing. There will be an Excel template that gets filled out that basically has facility information, a random employee ID to get to John's point about it being anonymous, but so that you can identify survey, from this employee, from that employee. So you can number them, you can letter them, whatever you want to do. But to make it anonymous, and then you'll input the data, right? On question 1, the score was a 3. On question 2, the score was a 4. And then you will upload that Excel file to the state, which that's how they'll compile the data.
Great. And we had another question on the presentation, getting a copy of the presentation from someone in the chat. We will make sure that is sent out to you. Another question. We are currently using CoreQ via another provider. Will that data be allowed? So it's Abacus and HealthStream. And I think this is sort of a version of the same question that we talked about. I mean, as long as it's the CoreQ survey administered by a CoreQ vendor, then it's appropriate to sort of continue that methodology and that practice, right, Tom?
Yeah, and as long as you're following, CoreQ has very specific requirements about how those questions are administered. You can ask other questions with them, but the CoreQ questions have to be the first ones. Yeah, and there's certain parameters you got to follow as far as how often you have or how soon after a discharge you have to collect them and those things. As long as you're following the CoreQ requirements, you should be okay.
Yeah. And I mean, relative to the AHRQ requirements, I think it's also worthy of note, sort of within the context of that conversation, I mean, Robin, you want to give a quick note on AHRQ and the specificity that they very, specifically emphasize that you have to maintain the exact nature of the survey. You want to just emphasize that point a little bit?
Yeah, the guide does say that the survey has to be administered pretty much verbatim how it's written. So you cannot modify the questions or the order format, it needs to be pretty much verbatim by how it's written for it to be considered a valid survey.
Right, right. I guess I think that they say that you can add questions afterwards, but from a compliance standpoint, I think it's probably pretty important to be on the nose as far as those things are concerned.
Yeah.
Those are all the questions that we have. We had a great group today.
John, can I
Tom,
ask
do you have
one
any final
question to
thoughts?
Robin?
Yeah, you bet.
So, and this is something that I had to kind of wrap my mind around. Can you explain how the CoreQ survey is scored from a satisfaction level? I think we see that 1 through 5, and we're also used to looking at like Amazon reviews. And if you have 100 5 stars and you have 100 3 stars, it's a 4-star product. Can you explain how the CoreQ is scored a little differently than that?
Yes, so this CoreQ satisfaction score is a little unique. And the satisfaction score defined by the CoreQ user manual is the percentage of valid responses with an average score of greater or equal to 3.
Yeah, so I mean, resident A submits their data on the 3 questions, and they give you a 3 on question 1 and a 3 on question 2 and a 4 on question 3. That's a 3.33, which would be considered a satisfactory survey. So, with that survey, you're at 100%. So whether your average score on that survey is a 3.2, a 4.5, or a 5.0, those are all considered satisfactory. And your facility level score is what percent of your total surveys met at least a 3.0 average on those questions. So, I think people get a little nervous when they're like, well, we get a bunch of 3s or a bunch of 4s, we're going to be a 3.5 stars or whatever. As long as the average for that individual survey gets to that 3.0 number, that's considered satisfactory. And that's the kind of the score they look at.
Right. We actually did get another question in. Great question, Tom. Good context for folks there. Will there be a requirement for a percentage of employees who need to respond to the AHRQ survey? And my sense of things is, from the rulemaking process not being finalized, those are probably that's sort of up in the air to a certain extent, but there will be some form of benchmark, probably, most likely, right, Tom?
Yeah, the legislation specifically speaks to AHCA kind of adopting a rule which must include a survey participation rate. So AHCA will, through the rulemaking process, adopt that participation rate. So there will be one. We don't know what it will be yet, but there will be a survey participation rate.
Great. Well, thanks again to my fellow panelists, Tom Parker of FHCA and Robin Safford here from CareFeed. Thrilled to have all of you guys join us. We did actually just get one more question. Where will the CoreQ survey responses be posted? So the survey responses are uploaded into long-term care trend tracker ultimately. But Robin, do you have other context that you would provide relative to that question?
Yeah, I can. So, if you're utilizing CareFeed to distribute your CoreQ surveys, you would be able to log into your CareFeed portal and see those responses. They would obviously not have a resident attached to that specific response, but you would see overall response scoring and averages. And then, like I mentioned, once the survey concludes, I would send you a report with your responses and how your facility scored.
Great. Great.
And the state's going to post it on the Florida Health Finder site as well. Is where I'm envisioning. There's language in the law that specifically speaks to all of the things that are on Florida Health Finder. Beds, administrator, languages spoken, all of those things. It does add language into that section that speaks to the results of the consumer satisfaction surveys. So your CoreQ satisfaction rate is going to end up on your Florida Health Finder entry as well at the state level.
So we're still getting some questions coming in here. So I think we'll continue answering any ones that come in. One
I can
question
answer
is,
those.
CareFeed will submit the CoreQ to AHCA, correct? And the answer is yes, right there,
Yes.
right,
I
Robin?
confirm with the community before I submit those results, but then if I get the go ahead from them, I will submit on their behalf.
Great. Well, really great discussion. Tom, thanks so much for joining us today. Really appreciate it. Robin, thanks for your insights. And thanks to everyone for joining us. Have a great afternoon.
Everyone.
Thanks, everybody.